Sports medicine. Introduction to the module. Sports medicine deals with a wide range of illnesses including trauma, fractures, strains, dislocations and many chronic overuse injuries. This module will teach you the fundamentals of sports medicine including the general considerations required for sports medicine. It should be noted that this course will try to give you a general overview of sports medicine and its use. But, we always suggest that you consult with your psychiatrist before taking any kind of medicine. Topics to be covered. The definition of sports medicine. The history of sports medicine. The purpose and necessities of sports medicine. The practice of sports medicine in modern day. General considerations in sports medicine. Who is a team physician? Time requirements of a team physician. Core knowledge of the team physician. Medical responsibilities of the team physician. Administrative responsibilities of the team physician. The definition of sports medicine. Sports medicine deals with injuries or illnesses that results from participation in sports and athletic activities. It is concerned with the proper functioning of the human body as well as the management of sports injuries. This field continues to evolve for many reasons. People are participating in a greater range of sporting activities than before in order to boost or sustain their fitness level. As a result of the increased number of athletes, there has also been an increase in the number of high-risk activities. Thus more people are participating in the dangerous sporting activities. The history of sports medicine. In ancient Greece and Rome, athletic contests were the way of everyday life. Physical education and training were important, and medical specialists evolved for the care of the athletes. In fact, the first use of therapeutic exercise is credited to Herodicus, a 5th century BCE physician whose theories are considered the foundation of sports medicine. Herodicus is considered the teacher of Hippocrates, the father of medicine. During this time, other notable sports medicine figures included Eacus of Tarentum, about 444 BCE, who wrote the first textbook on athletic training. Milo of Croton, who was a heroic athlete and winner of 5 consecutive Olympic championships. Milo encouraged athletes to gain strength by lifting a bull every day, starting from the day of the bull's birth. The first documented team physician arrived much later, during the 2nd century CE. Appointed to treat the intrepid gladiators, Galen performed copious amounts of research in anatomy and physiology. Galen's works became the principle of the medical knowledge of the Western world. The purpose and necessities of sports medicine. Professional athletes, like recreational athletes, are witnesses to the advancement and expansion of sports medicine. This advancement is most likely due to the increased financial incentive for participating in a professional competition, which has increased dedication to sport achievement, even at the sacrifice of physical safety. In addition, previously seasonal athletes now choose to undergo year-round training to gain an edge over their competition, leaving the kinder, gentler period of seasonal practice in the dust. Due to this extensive growth in the popularity of sports, there has been an increased interest among members of the healthcare professions to pursue careers in this dynamic field. To combat the rise in sports-related injuries, coaches, trainers, and physicians have united to develop sporting facilities, which often house state-of-the-art diagnostic and therapeutic equipment. Science also has opened the nutritional understanding of the athlete and how diets, supplements, foods, and drinks affect athletic performance. Sports science not only concentrates on injuries alone but also targets game engineering. Scientists and athletes are always looking for cutting-edge equipment to enhance athletic performance. Other research targets body engineering. Scientists search for physiological and chemical pathways in the body that can be manipulated to produce better athletes. The study of endorphins and their actions in the body is an example. They explore various doping strategies, some to formulate agents not detectable on health screens and others to look for better detection methods of such agents. Doping in sports has progressed to include gene doping, which is on the rise. From this process, Some scientists are producing genetically modified athletes who are physically superior to their counterparts. The practice of sports medicine in modern day. The term sports medicine was coined at the 1928 Olympics in St. Moritz, Switzerland, when the Association International Medico-Sportive Committee met to plan the first International Congress of Sports Medicine. It was held that year during the 9th Summer Olympic Games in Amsterdam. At least 280 sports physicians from 20 countries attended. In 1968, while attending the Summer Olympics in Mexico City, Canadian Dr. J.C. Kennedy concluded that well-organized and qualified medical care should accompany competing athletic teams. He became instrumental in the founding of the Canadian Academy of Sports Medicine, CASM, in 1970. Soon after, Dr. Kennedy was appointed Chief Medical Officer of the first true medical team at the 1972 Summer Olympics in Munich, Germany. Without science, sports wouldn't be what it is today. Injury is inevitable, and prevention is the key. Scientists are redefining old sports equipment and developing new equipment to avoid sports-related injuries today. In addition, they are unveiling innovative gear designed to enable disabled athletes to join the ranks safely. Science and technology play an important role in making a correct diagnosis of a sports injury, which improves the likelihood of a full recovery. New diagnostic techniques, such as various imaging modalities, permit physicians to peer into the body without breaking the skin. Injuries of bones, ligaments, and muscles are readily discernible when visualized in digital 3D reconstruction. Science also breeds specialized care and new therapies. Studies are evaluating the advantages of certain therapies as compared with wait-and-watch approaches. New surgical methods are more discriminate and minimally invasive, resulting in quicker and more total healing. General considerations in sports medicine. Who is a team physician? The team physician works for the well-being of individual athletes, enabling each to realize his or her full potential. The team physician must have an unrestricted medical license, be an MD or DO who is responsible for treating and coordinating the medical care of the athletic team members. The team physician should possess special mastery in the care of musculoskeletal injuries and medical conditions encountered in sports. Time requirements of a team physician. A team physician must have an office schedule that can accommodate athletes with urgent and time-sensitive medical needs. Most team physicians have set aside time each week, at least 1 to 2 evenings, to assess new and follow up on current injuries to team members in the training room. The amount of time spent at the actual competition depends on the team physician's role and availability, as well as state laws and regulations of the governing athletic association. Core knowledge of the team physician. To perform his or her duties effectively, a team physician needs an understanding of the medical conditions common to the athlete. This knowledge should encompass many areas of medicine, including but not limited to orthopedics, cardiopulmonary medicine, neurology, dermatology, and sound principles of rehabilitation. The team physician also needs expertise in pharmacology. Practical pharmacology for the team physician includes not only knowing how to treat illnesses but also an understanding of performance-enhancing drugs and herbal medicines. A team physician's knowledge of exercise science and nutrition can help prevent injuries, as well as maximize an athlete's performance. Medical responsibilities of the team physician. The first responsibility of a team physician is to determine whether an athlete is fit to participate. This evaluation most commonly occurs during the participation physical. Sideline and event coverage is the most obvious responsibility of the team physician. A physician should cover all collisions and high-risk sports. The team physician must be prepared to handle non-participant emergencies, for it is not uncommon for the team physician to be called on to treat an ill-fallen coach, referee, or spectator. Administrative responsibilities of the team physician. The team physician's primary concern is the coordination of medical supervision. This organization includes making sure qualified medical personnel are attending practices and competitions as needed, designing a plan for sideline evaluation, and having necessary medical equipment readily available. The team physician needs to lead the planning for and the practicing of medical emergencies and urgencies. The team physician oversees the playing environment. He or she should evaluate both practice and game facilities for safety. Summary. In this module, we have covered the following. Sports medicine deals with injuries or illnesses resulting from participation in sports and athletic activities. Like the recreational athlete, professional athletes witness the evolution and growth of sports medicine. Science also has opened the nutritional understanding of the athlete and how diets, supplements, foods, and drinks affect athletic performance. Science and technology plays a vital role in the accurate diagnosis of a sports injury that results in increasing the chances of complete recovery. The team physician should be an expert in the treatment of sports-related musculoskeletal disorders and medical conditions.